Hi everyone, so I just want to take this time to talk a little bit about some of the comments that have been coming up a little frequently on my YouTube videos so far. So some of them have been kind of alluding to the fact or just blatantly saying that I'm faking having schizoaffective disorder, or that they're not understanding how I can be so successful in my career and school with the diagnosis of schizoaffective disorder. So because of that, I just wanted to take this opportunity to talk a little bit more about how schizoaffective disorder and schizophrenia affect everyone a little bit differently. So the symptoms that come along with schizoaffective disorder or schizophrenia can look different from person to person, and not one person experiences it in the same way. So a term that's often used is high functioning versus low functioning, but I also want to point out a problem with this, because when you say somebody is high functioning with a mental illness, it kind of alludes to the fact that there are people who are low functioning, which isn't very nice to refer to people as. So instead of that, I just wanted to refer to everyone as experiencing it in different ways. The reality is that because it affects everybody differently, some people are going to struggle a little bit more with the illness than others, and some people will have a more difficult time coping with the illness and with the symptoms than others will. This can be for a multitude of factors, but there are also some protective factors that can influence how a person experiences a mental illness such as schizophrenia or schizoaffective disorder. So one of these factors is that the simple fact that I'm female. This is a protective factor for people living with schizophrenia or schizoaffective disorder. Another factor would be that I come from a middle-class family and that I have a university education. So my education has allowed me to have a little bit better insight into my illness, and it's just kind of been a protective factor in terms of dealing with my mental illness. Another example of a protective factor is having children. So it's been proven by studies that having children is protective for mothers with schizophrenia or schizoaffective disorder. So along the same vein of people experiencing schizophrenia or schizoaffective disorder or mental illness in general differently, I also want to point out the fact that it's really not a competition. So a lot of the times, this criticism that I've been receiving or whatnot around not being sick enough basically is coming from other people who are struggling with their own mental health. And really, we should just be rallying around to support each other rather than competing with each other about who is more sick or what an illness really looks like. I think that we have a lot to learn from each other regardless of the degree to which the illness affects us, and all of our experiences are valid. So I just wanted to address this quickly, but know that wherever you are in your mental health journey is okay. So thank you so much to everyone who has reached out in the comments, by email, on Instagram or Twitter. Your support has meant so much to me, and I really appreciate it. So thanks again so much for watching, and have a great day. Bye. Thanks again for watching. Make sure to subscribe to see future videos, and if you would like to help support the creation of these videos, please check out my Patreon page. The link is in the description below. Thanks again.